Would I benefit from a blepharoplasty procedure? I have been very concerned about the lower lid. I'm 46 years old and don't wear any makeup. I've been very concerned about the lower lid. I don't know who else to ask, so I thought I would try this website. Since I have no way of covering up my eyes, I wear glasses all the time. In your professional opinion, would I really need this procedure? I would like to know before I spend money. Thanks.
Thank you for your question. You're 46 years old and you're asking if you'll benefit from a lower eyelid blepharoplasty. Well, in reviewing your photo, there is certain things that I would have you notice before moving forward with the lower eyelid blepharoplasty. First, understanding what are the intentions of a lower eyelid blepharoplasty. Well, lower eyelid blepharoplasty addresses puffiness, eyelid position, and to a degree, when appropriate, excess skin. So, if you have puffiness under the eyes, and it appears you do, then addressing the lower eyelid area will make sense to have a blepharoplasty. But also I'd ask you to look in the context of the area below the lower eyelids, in the cheek area. At 46, you've probably noticed that there's been some volume loss. A few years ago, I wrote a book called The Fine Art of Looking Younger. And the point of writing this book was to help people understand the facial aging issues that we deal with every day in our practice. And the questions are always about correction with volume and fillers versus dealing with correction by surgical procedures. And it has to do with just essentially two simple principles. As we get older, we lose volume, we lose bone, muscle, and fat, and then we also get laxity. Things get loose. The lower eyelid tendon, for example, becomes looser. The obicularis oculi muscle gets a little bit more laxed. And so there's a support issue that may be part of the whole lower eyelid rejuvenation process for you. Now, when we do an evaluation for lower eyelid blepharoplasty, we also look at the tone in the lower eyelid. We do something called a snap test. We pull the eyelid down and see how well it comes back up. So addressing the fat pocket as well as maybe lifting or tightening the lateral canthal tendon may be necessary. And then, of course, looking from different perspectives, we have to kind of see if there is relative prominence of the eye to deal with any type of support structure in the lower eyelid. I also wrote an article many years ago called Ethnic Considerations in Eyelid Surgery. And it was a response to a time where more and more people who are not Caucasian were embracing and exploring cosmetic surgery procedures. And unfortunately, traditional cosmetic procedures, particularly like lower eyelid blepharoplasty, where an external incision is made and the lower eyelid is opened up and fat is removed and then skin is removed, for people who ethnically, such as those of African origin, have prominent eyes, that became quite problematic and it resulted in the eyelids being pulled down. So I wanted to share with you that someone of dark skin color has to be also mindful of the techniques applied to lower eyelid blepharoplasty. At the same time, in order to optimize the aesthetic appearance of the lower eyelid, taking away the negative is one part of the equation, and then possibly addressing volume loss can be the second part of the equation. So you need to consider that as well. By adding volume in the cheek area, whether it's through augmentation with fillers, whether it's through augmentation with the cheek implant, whether it's even through lifting by facelifting, it can have a tremendous impact in the context of how the eyes look. The last part of this equation is that I always look at skin quality as well. People often mistake having lower eyelid surgery as a way to either reduce wrinkles or to reduce dark circles. So to address the skin quality issue, we actually routinely use something called platelet-rich plasma in our practice for lower eyelid rejuvenation. We actually draw your own blood, we spin it, and we concentrate the platelets, the cells necessary for healing when you have a cut, as well as the growth factors necessary for healing as well. We take this and we place this under the skin of the eyelids, and we have seen a qualitative improvement in the skin. And that includes diminishing or improvement of wrinkles, improvement in skin color, and an overall healthier glow to the skin, which considerably diminishes with every passing year after around the age of 30. So I think in summary, the suggestions, of course, are to understand what elements of the lower eyelid should be addressed by lower eyelid blepharoplasty, since the term blepharoplasty simply means to change or to operate, to do surgical procedure on the lower eyelid, but there is a wide spectrum of options that come with that. And understanding the relative support of the lower eyelid, the position relative to the eye, the volumetric loss at the adjacent area in the cheek area, and as well as the skin quality. So meet with experienced cosmetic surgeons who know this area very well, who have a lot of experience with darker skin types. And once you find someone that resonates with you, I think you will find that this will be something that will help you feel better about the lower eyelid area. So I wish you the best of luck. I hope that was helpful, and thank you for your question.